back to another episode of the Choose954 Podcast, episode 115, with Dr. Ilyas Hamid from his office here in Hollywood. If you didn't know about Choose954, myself, Evan Snow, my business partner, Andrew Martineau, started a social movement to cultivate culture and community here in Broward County, to keep people to know with great things that are going on, to make this a better place to live, and not just a better place to vacation because we live here. The point of the podcast is to connect you with interesting people like him that do a lot of important things in the community, and you're going to get to find out a little preview of his story here ahead of him sharing his full story at our monthly breakfast lecture series mini TED Talk event, Creative Zen, on Friday, September the 12th, which we'll tell you a little bit more about. But without much further ado, your journey started in nutrition and personal training before getting into this world of Chinese medicine and functional medicine. Kind of tell us a little bit about how you kind of got started on this path and kind of what led to your transitions here.
Sure. You know, when I was young, I had 3 older brothers. I have 2 now. And, you know, it was a house full of boys, 1 girl. And we were boys, you know, we liked to wrestle and, you know, play around. And I remember looking up to my brothers and wanting to be like them. They were very strong and athletic. And they probably got that from my father. So growing up, we were very athletic. So my brother was a wrestling coach in Broward for a long time. He wrestled in high school. He went to states, took 3rd. My other brother was another amazing athlete. My other brother won karate competitions. So when I was young, my brother used to bring me to wrestling practice with him in high school when he was in high school. And that was from kindergarten to 8th grade. But then as I got older, I got into soccer and I got into basketball and I got into a bunch of different kinds of martial arts. So I was always very active. My entire childhood, I was outside kicking my ball against the wall or playing basketball at the park or in the streets with my friends. And then I got into high school and some life got to me. I experienced some trauma throughout my life. And it started catching up in high school, and I went into depression. So that was my first experience of mental health stuff. But then when I got out of high school, I started gaining a lot of weight because now you're an adult and you have to work and you don't have time to play and go exercise. And I was getting little injuries here and there that accumulated. And I started losing my physical capacity to exercise, to enjoy my life, to do the things that I love to do. If I could, I would spend all day long outside playing basketball, doing Tai Chi, you know, that's all I would do with my time if I could. And when I lost the physical ability to do that, it put me into a depression. Mm-hmm. And so I went to PTs, I went the doctor route, I did medications, I got x-rays, nobody could figure out what was wrong. And nothing helped, and I couldn't go outside and exercise it off. You know, when you exercise, your body releases something called BDNF, brain-derived neurotrophic factor, and it's actually an antidepressant. It lowers inflammation in your body. I learned this later, but I wasn't getting any natural antidepressants. So I got so depressed that my immune system got suppressed. And I had a shingles outbreak on my chest when I was 23 years old. I felt it come around, and I knew at that point, something was wrong. Nobody was there to help me. At least that's what I felt at the time. That was my experience. And I had to figure it out for myself. So I said, you know what? I'm going to go the natural route. I'm going to study dietetics and nutrition, and I'm going to become a personal trainer at the same time. So I learned how to rehab my body on my own by learning from other trainers. I learned something called neuromuscular reprogramming with functional exercise, and this was way before functional training was a household name like it is now.
It's 20 years ago, 15 years ago?
15 years ago, yeah. And so, you know, I learned how to rehab my body, and I learned how to eat and everything based on what I was learning in school at the same time. And I had great success with what I was learning and helping my clients with at FIU. But still, at that time, there were some shortcomings with what I was learning. There was still like a small population of people I couldn't help, and I didn't understand why. Maybe it was because at that time I was not as knowledgeable about how mental health is so influential, and how I didn't really have a good comprehensive understanding of how pain affects the body. So I decided, okay, I'm going to go to Chinese medicine school, and I'm going to learn acupuncture, and I'll do nutrition dietetics with acupuncture and exercise, and that'll be the trifecta to help people. And you know, it was one door that opened up into another door that opened up into another door that just continued to go, and it was constantly like searching for another answer to help people who were being failed, who were not being supported by the system.
Right.
You know, they went through the system, they come to me, and I'm going to figure it out. So I had to continuously go through different steps of learning and getting more knowledge.
And those rabbit holes go very deep.
Yeah. I always say that Chinese medicine was like a window I stepped through that opened up into a whole new universe. Literally. And it's interesting. I'm seeing the parallels in your story from the way that we got connected, which is through one of my best friends, Dr. Seth Gilson, the mindful doctor, who you were one of his first guests on the Art of Mindful Medicine podcast that he hosts. Yeah.
And also he had a similar, played soccer, got injured growing up, thought he was going to be a professional soccer player. We need you on the podcast, Seth. And and then, you know, had an injury, wasn't able to play, had medical issues, depression, was searching, and then obviously found his path as you did.
Mm-hmm.
And you're not Chinese by nationality.
Well, supposedly, that's what my mom says. Like, I have a small percentage of it, but, you know, I've never done my genealogy or anything like that.
Okay.
These are just things that her family told her growing up, but it's like, you know, a great-great-grand aunt.
We're all connected. But you went and trained at the Shaolin Temple in Beijing's Gulou Hospital of TCM. What was that experience like, and what was kind of that eye-opening component about learning in these environments, literally in a different part of the world?
Yeah, you know, if you travel, and I'm sure most of you travel too. When you leave the country, you start to see that we start to break free of the mindset that we know everything. There's different perspectives that are very influential and helpful. And that's really what happened to me. My eyes became awakened. I became awakened to there are other options that work, you know? So when I went to Shaolin, just to like kind of keep it short, Shaolin was, most people go to Shaolin to study martial arts from Shaolin monks. And the story of that is Bodhidharma, he was a Hindu monk that climbed over the mountains of the Himalayas, and he meditated in this cave for 9 years, and when he came down from the cave, he brought Chan Buddhism down with him. And when he meditated, he atrophied his legs, so he taught his students it's really important to stay fit, so that they stayed fit by doing martial arts. So that's kind of the origination of Shaolin. And throughout the centuries, they continue to learn, and Chinese medicine is heavily involved with martial arts. So that was the physical training, while doing the herbs and the meditation and the qigong and the spiritual training. So when you go to Shaolin, you're living the lives of the monks, which also includes martial arts. But we also had a special program, the only medicine program that Shaolin ever held outside of the temple for anyone else. So we had the monks that were doctors come in and teach us medicine too. But their medicine was more, you know, they had the practical aspect of it, if you were sick, if you had pain or something. But they really focused on the esoterics, so understanding how the universe and feng shui and like when you're born, how all these things influence you on a deep level. So at Shaolin, we got a really good in-depth spiritual understanding of medicine from Chinese medicine. Just to make it really short, because there's amazing stories I could tell you about that. Like the monk that could like go into different dimensions and tell you if you had spirits following you, and he could predict like when you were going to die and things like that. That's a whole other story for another day.
What they've been doing for thousands of years, tried and true.
Yeah, he told me what my backyard in my house looked like, the one that I grew up in, and how the feng shui of that house was influencing my health, and what I should do to like heal myself by going and influencing the feng shui of the house. It was a whole other level, man. So that was cool, and I could talk about
pretty eye-opening.
yeah, it was profound, man, and you know, I could talk about that for hours, but to keep it short, you know, that's what I got there. But we also interned at a hospital. At that hospital, it's called the Beijing Hospital, Gulou Hospital of Traditional Chinese Medicine. So when you go to hospitals, most hospitals in the world are mostly conventional medicine, 90% conventional medicine. You go in, you see the specialist, you take the x-rays, take your blood work, treat you with medications, do surgery, things like that. And the same thing goes for China. In 90% of the country, like most of the country, it's like that, and there's a small wing for acupuncture. This hospital was the opposite. Yeah, it was like 90% Chinese medicine and 10% Western medicine. So you would go in and you do an x-ray or an MRI or something like that, or your blood work, and the Chinese medicine doctor, which was also an MD, would take your findings, review it, and then treat you with acupuncture and herbs and Tui Na and cupping and moxibustion and things like that. So they had different departments throughout the hospital: dermatology, pain management, all these different things, gynecology. So I was able to go into a hospital, which is emergency medicine, right? It's not internal medicine, primary care. It's emergency medicine. And I got to experience how traditional Chinese medicine was being used in emergency situations. So they had inpatients that would stay at the hospital for so many different days or weeks or whatever, and they would treat them daily with herbs and acupuncture and moxibustion. And the results were amazing. You know, I got to see the patients, I got to learn about their experience. It was, and that, what that did for me was it just like, it was more confirmational that like, yes, this works. Here in the West, we know so little. You know, we're only a couple hundred years old as a country. These countries are thousands of years old. Thousands of years of knowledge, tried and true application, right? The longest human clinical research trial in history, undocumented, right? They went through trial and error with the herbs and the acupuncture over and over to see what worked, right? Here we have to have the research study. Show me in the research where that works. Well, their experience is the research, and my clinical experience in the office every day is the research, you know?
And I know that there's not as much money in the herbs and the needles for the acupuncture. That's another story for another, you know, versus this medical system here. Maybe just for those at a high level that have never experienced acupuncture, could you just give us like the high level overview from your, not from the proper training perspective that you've experienced?
And what do you mean by overview?
Just like if somebody's like, I've never done it before, I don't know what it, like, how could that help me? They put a needle here and that.
Okay, sure. Let's put it like this. If you have something going on in your foot, if you have something going on in your eyes, if you have something going on in your liver, all of those areas of your body are a part of your body. And all of them, on a very basic level, have a nerve ending, right? All of them communicate through your body, through the nervous system, through the endocrine system, through the immune system, right? Those are your main means of conversation within your body. When you put a needle in your body, first thing it's doing is it's activating the nervous system. So if I put a needle here, it's going to activate the nervous system around your heart area. If I put a needle here, it's going to activate your nervous system around your brain, right? If I put one here in your arm, in your skeletal system in this area, that nerve response sends a signal to your body that there's some kind of a foreign invader. Just like if you got sick, right? If you got sick, your immune system would respond.
Right.
So your body responds in its own way by sending your immune system natural painkillers, endorphins, to help heal the area. There's a foreign invader here, let's send help to the area. And by sending help to the area, if it's in your heart, if it's in your knee, it's bringing fresh blood with all these things that are intended to heal it.
Interesting. And I happen to be a grateful patient over the years now, and some ailments that have brought me to you have been treated multiple visits. Some of them were treated in one visit, but the one part that we always find the most fascinating, when you and I don't know if you recall off the top of my head the issues I've had with my shoulder or my traps, that you have helped me get a great release. What is that release
Okay.
that we marvel at?
All right, so when we talk about muscle knots, I've got a knot in my neck or something. That knot can develop from just sitting like this all day. Your shoulder's elevated. So if your shoulder's elevated, your trap is being activated to some degree. And let's say I'm working at a desk and I'm hunched all day like this. So one part of it is I'm hunched and I'm activating the traps. But what if I'm stressed too? Or what if something happened at home and I'm angry or whatever? That starts to lock you into that position. And that starts to take those activated muscles and tighten them and tighten them and tighten them until we get muscle knots. So from a physical perspective, if we're treating pain, it's the easiest thing to treat. It's about getting into those knots, sticking a needle in that knot, and then it releases. And when it releases, you'll see what's called a fasciculation, which is that muscle knot going and sometimes you can see how the entire body's connected, because you can do a knot here and you can see how it goes down the back, because this connects to your rhomboids connect to your paraspinals, and sitting here you might feel it here, but your whole body's getting tense from sitting here like this. Sitting like this is shortening from here to here, so all of this is getting tightened as well. So if you're sitting all day, this is getting shortened, which means tightened, and if I'm tense like this all day, it's going to start to affect my back. My whole body's going to get involved. So when you see a fasciculation going down the body, you can see like where the whole body's been tense, locking into that pain area right there.
Amazing. And I mean, nothing I've ever experienced. I mean, I go get massage, I go get chiropractic adjustments, I do sauna, cold plunge, things like that. But nothing I've ever experienced has given me the amount of relief. Once again, not always through one session. Sometimes it takes multiple appointments. But phenomenal how you've helped me. Traps, back, shoulder, so many things. So I'm grateful. Your clients are grateful. You can go on your Instagram and hear other success stories of other ailments or conditions or things. And, it's not always a guarantee. It's not a one-size-fits-all approach. But if you are committed to the process and you do want to get the benefit, then it is there. And I know that there's a lot more to it, and we're not going to get to all of it with the meridians or otherwise people might know the chakra systems or the energy lines and so on and so forth. But your doctoral capstone bridges Chinese medicine and Western biochemistry. So in simple terms, how do stress hormones and immunity all connect to impact our health, for those that might not be realizing it?
Man, that's always been the most fascinating thing to me, because like you said, we learn about the chakras and the meridians, and here in the West, we're a Western-based, scientific method society. So when we talk about energy flow throughout the body, that just doesn't make sense, right? There's no way to measure that. But clearly, there's something happening to the body where I put these needles in a person and their anxiety is getting better, and their digestive system's getting better, and their hormones are getting better. And women come and they're in extreme pain from their menstruation, and they lay on the table and I put a couple needles in and the pain's gone. So I always thought, like, there has to be some kind of scientific explanation for this. You know, it's not just energy, it's both. And actually, in Chinese medicine, there's no separation between the physical body and the energetic body. That's a whole other discussion, you know? But, so basically, what I've come to at this point in time is there's a field of study called psychoneuroendocrine immunology, which is how the psyche connects to the nervous system, and how the nervous system connects to the endocrine system, and how the endocrine system connects to the immune system. And you have to have like a high level, or at least a moderate level degree of knowledge between each of those systems to understand how they all connect, right? So the psyche, mostly what we're talking about is the limbic system, the amygdala, and the prefrontal cortex, and how those areas process how we perceive our life, how we perceive the world. And if I had a lot of trauma, it changes the way that I perceive the world, right? If I was loving household, supportive growing up, changes the way I perceive the world. So whatever is going on in the psyche aspect, it's going to influence the nervous system. So you can be put into a fight or flight response, or sympathetic activity, which is anxiety. It can turn the nervous system and wire you up. I had this experience, the psyche, that sends a signal to my nervous system, and the nervous system is kind of wound up. That now the nervous system starts to send signals to the endocrine system. And what is the endocrine system? That's our hormones. There's our sex hormones, there's our stress hormones, there's our digestive hormones. There's so many hormones throughout our body, so they can all get affected. But mostly what we're talking about in terms of mental health is our stress hormones. So your nervous system gets wound up, puts you in a sympathetic state. Now it's winding up your stress hormones. When your stress hormones get wound up for a certain period of time, your body deconditions to them. And now the immune system's involved. So something that was once anti-inflammatory now becomes pro-inflammatory. So now this connects how my psyche, my personal experiences, how I perceive the world shows up in how I stress, and how my stress influences my immune system, and how that can weaken me and leave me susceptible over time. So if you've been dealing with something personally your whole life, 20 years of having a wound up nervous system, which is influencing your immune system, it's going to cascade. And this is how most autoimmune conditions show up.
And this is what some people are now starting to hear more from, like Dr. Gabor Mate, of like untreated trauma or anything really younger in life, if not, treated or not paid attention to, turns into disease later in life.
100%. Have you heard of the ACEs study?
Tell us.
Yeah, it really broke the mold. So it started, and it really spoke to me because it started out as a weight loss program, which as a trainer, as a nutritionist, I was the head trainer for the program. I did all the meal plans for everyone. I did all the measurements for people. We had 200 plus people per semester.
At FIU.
At FIU. And it was a weight loss program called the Lose It program. So back then, The Biggest Loser was on TV, and it was like influencing people. So we created a program to recreate it. So we had all of these participants, and it was we put them on a diet, and we put them through exercise weekly. But some reason, some people didn't get better. So that's what was happening with Kaiser Permanente. They had this huge weight loss program, and they found that there was a group of women that, as they hit their weight loss goal or got close to their weight loss goal, they would regress and they would gain more weight. So they questioned them, and they found out that when they lost weight, they felt more vulnerable to abuse. And they found out that a lot of these women had trauma throughout their life. So the CDC created another program and found that it's called the ACEs study, Adverse Childhood Experience Study. So if you had these experiences through your life, your chances of suicide your chances of cardiovascular disease, diabetes, increased exponentially with each ACE. So that it was a 1-to-1 correlation where it was through trauma, it's showing up as physical illness.
Mm-hmm.
Yeah.
And it's real. And if it's not attended to, and if it's not treated, I mean, you're only going to have problems.
Exactly. And, you start to look around in society and you start to see, there's a lot of obese people, overweight people, a lot of mental health issues in this country. That was the number one thing that I realized when I came back from Japan is, like, I immediately felt anxiety just from coming back here from, fear of survival. Like, you got to be careful what street you're walking
right.
down. You've got to make money to live. You've got to be careful who you cut off in the road, and immediately your anxiety levels slowly increase.
Right. That's not always the case when you're in different parts of the world where those threats or those levels of anxiety aren't always there from different cultures and different ways of being.
Exactly.
Which is a whole nother story for another day. But I'm so glad that you've developed these resources, these tried and true methodologies and practices, and have brought them here to the community in downtown Hollywood, right off of Dixie, and right just north of Hollywood Boulevard here. And you've been able to help a lot of people, and I understand this practice with Dr. Clark has been able to help a lot of people for a long time.
Yeah.
If they're interested in learning more and finding out about the practice, what's the website, social media?
So my practice is Balance Integrative Medicine. There are other practices in the area with the same word balance in it, but that's not my practice. It's Balance Integrative Medicine. You can go on Google and you can look up my Google reviews. It's probably the best way to see like my results. Balance Integrative Medicine. On Instagram, I'm iBalanceUs, and my website is acuhollywood.com. ACUHOLLYOOD.com. And I'm just going to give a shout out to Seth. Seth is the Mindful Doctor on on Instagram. Seth is the reason why I got on Instagram. I didn't have an Instagram before. Yeah. Yeah, so I've got to give a shout out to Seth. And Seth does holistic dentistry, which I'm so grateful that he exists, and he's now working with someone that does that because, standard dentistry is a part of the conventional model, and we find so many issues with that, and thank God we have Seth to be able to help people in ways that they didn't know they needed. So check Seth out, the Mindful Doctor.
And I take it that was also one of your first podcasts as well.
That was my first podcast.
Yeah, okay.
Yeah, he said he wanted to interview me. I said, I don't have an Instagram. And I didn't know how to work Instagram, and I was trying to get on live, and it would cut out, and then it would come back in, and it was so bad. I feel so sorry. I'm still so sorry about that, Seth.
It worked out, and we ended up getting a clip that we used for the promo here. That's why I wanted to do this podcast to help preview and promote your story, because Ilyas is going to share his story at Creative Zen Talks, which is our monthly breakfast lecture series, mini TED Talk that we host for free every second Friday morning of the month, where many years ago now, almost 10 years ago, I received my aha moment, some inspiration that changed the course of my life, my community, in the world now through the work that we're doing from the way of this inspiration that I gained to become a creative entrepreneur, community builder, placemaker. So that's why I like to pay it back and pay it forward and continue to host this, going on 7+ years now, bringing in local people to share their thought-provoking, inspiring story. And it's not all, it's called Creative Zen. You don't have to be, creativity is not required. Being a member of the community is required. We are going to host it at our creative space, at our Zero Empty Spaces artist studio at the Dakota, the Design Center of the Americas, which is a pretty cool building not everybody's ever had a chance to be in. It used to be closed to the public, now it's open to the public, and we have 25 art studios there. So Friday, September 12th, the doors open at 8:30. The talk starts at 9. You're out of there by 10. Free event, guided meditation, got a breathwork exercise, some coffee, and thought-provoking, inspiring talk with the opportunity for some Q&A. And given that a lot of people that tune in here are creatives or entrepreneurs, that everybody struggles with stress and burnout. But what's one practical tool that a creative or an entrepreneur can start using right away to lower their stress load?
Yeah, I actually came up with something yesterday I wanted to make into a post. But before I do,
Sure.
I just want to acknowledge you because what you're doing is a labor of love. You don't get paid for this. You're supporting the community, and if not community, what do we need? We are very divided as a people in this country, and I acknowledge you and I respect you for taking your free time to do this for me and for everyone else. And you're setting an example, and I hope it proliferates and it grows so that we can continue to galvanize people. And sure, we see things differently, but that doesn't mean we can't be a community supportive of each other and each other's beliefs. And not only that, you're going above and beyond and showing people where they can get help. And thank you, bro. And they're here. This is beyond helping me. This is helping the community.
Amen. I appreciate that. Thank you for recognizing and saying that.
Oh yeah, man. I've wanted to do this for so long, but I don't have the willpower to pursue it.
Sure.
And you do, and you are, and I respect you for that, and I look up to you for that, for finding it within you to do this.
Yeah, by the way, we're here on a Sunday morning, on an off day, but, it's the time that works out, and it is, and serendipitous timing, full transparency, I appreciate you saying that, because my main business, the Zero Empty Spaces, is really taking a lot of my time and energy. I don't really Creative Zen, it's a free event. Choose954, we get a couple bucks here and there. Unfortunately, that's kind of dying out from the cities with budget cuts and stuff like that. But I do it, and I've always done it altruistically because it is the right thing to do. Who else is going to step up? And your story is most certainly worth telling. But Deco Drive, Channel 7, Channel 10, whatever, they're not coming to interview every local healer, creative entrepreneur, doctor, person that's doing good work in the community. They just can't. And how are they supposed to know about them? So that's why, a community-driven platform like Choose954, being able to have a podcast, have a camera, we have the lights, do a little edit. It is the right thing to do, to tell these stories, make some social clips, have people see it, because when I've traveled, and as you've traveled, and you've gone and seen other well-cultured communities, this Creative Zen event is inspired by something that takes place in over 200 cities around the world. That was where I had my initial aha moment called Creative Mornings. That did change my life for a fact. That's changed so many people's lives, so many communities, but nobody was really stepping up here in Broward to do it. So I really, it's not every day that somebody says that to me, because sometimes I'm almost like, shit, can I really justify the time to continue doing this for free when it's a very thankless work, community building?
Yeah. Yeah,
it's not for the faint of heart.
For sure. Yeah.
So I appreciate you saying that.
And also, it's I think I don't mind, and maybe the community wouldn't mind donating to something like this, right? Like you said, this job is a thankless job, work. To me, it's a labor of love, right? But I do think that the gratefulness of the community would not mind donating to something like this. I know I wouldn't mind donating to something like this. So, the community, the government, the local city doesn't have enough with budget cuts to support something like this. Maybe there's a way we can find the community to just donate whatever. You're already doing it altruistically, right? Maybe just a little bit on top can help, because you start to uplift the community in that way.
I appreciate that. Certainly open to it, and something I'm going to bring to I help with a goal setting accountability mini mastermind group called Accent Club that now meets monthly every first Tuesday, where we help people with the goals. And that's actually something that I was not crying out. I was asking for help with Creative Zen, because even like I've been doing it for 7 years. I've kind of gone through all the speakers I thought I was going to go through, the hit list of the people that I wanted to have share their story. And like now I kind of like need, there's new people, maybe I don't know everybody, so I need people like send me more people to share their story, or, help with the venue, help with the coffee, help with the setting up the chairs and stuff like that. So, I believe in 2023, I made my New Year's resolution the year of asking for help. And I did, and I was actually really amazed by like the responses that I was getting by putting it out there, like I need help. This is probably, this is good serendipitous timing, and I'm so grateful for you recognizing that and sharing that. And obviously I trust and respect your judgment and values and professionalism and all that. So I guess this is mutually beneficial and cathartic for both of us. So with that being said, and I guess you already just kind of answered it for me, but as many creatives and entrepreneurs in our community struggle with stress and burnout, what is one or what are some practical tools that they can start using right away to start to lower their stress load?
Right away. Okay. So I think the most important thing is self-regulation, learning how to control your stress response. And there are many ways to learn how to do that. But something that I find is very, very practical is finding at least 10 minutes out of your day, 5 minutes out of your day to just allow your nervous system to turn off. Whether that means you come home from work, you tell your wife and your kids, I just need 5 minutes, sit down on the couch, put on the TV, or go sit out in the back porch and sit, just enjoy the breeze for 5 minutes and just don't do anything, right? We're always doing. Give yourself 5 minutes to not do. And some people say, I can't sit still and I can't meditate. It's because your body is so wired, right? So like when you're trying to turn it off or give it a break, it's in automatic, right? That's the autonomic nervous system. And you condition it to be automatically wired. So give yourself just a few minutes to just turn off, don't do anything. That's it. Something as simple as that.
And think to yourself, when was the last time you did that? And I have been mindful of that as, yes, we're all in go mode. When I go to the sauna, I now try to read in the sauna and meditate in the sauna. Thankfully I have one in my building that allows for that. But if you can prescribe yourself these tools, gifts, resources, or even like going to get it sounds so basic, but like when you go to get a massage, you are not looking at your phone for an hour.
Yeah.
Or a workout class or a yoga class.
You're not doing.
Yeah.
You're not doing, whether it's mental work or physical work, you're just allowing.
And that's where so many benefits with an autonomic nervous system and so many processes, right, are, just as it's important to get good sleep, which I know you're a proponent of as well, are so important to the overall picture. And speaking of the overall picture, I guess this would be a good time. There's another form of medicine that you've gotten involved with that some people are familiar with, not everybody is familiar with. Could you talk to us a little bit of, I know you treat complex conditions, IBS, PCOS, migraines, autoimmune disorders, and I know you've gotten into functional medicine. So could you just share a little, bit of how your integrative approach helps somebody turn a corner with conditions like that or less?
Absolutely, man.
And what is functional medicine?
And what is it? Yeah. So functional medicine, I put it in my own terminology. Functional medicine is a Western approach using Western biomarkers to treat root cause conditions. Simple, That's it. So when you go to your doctor and when you go to the hospital, you have to know what they're there for, right? Like, the medical system is not there, and you can't get mad at the doctors for this, right? Because that's not what they do. It's like going to a pizza place and asking for sushi, right? They don't make sushi. So when you go to the conventional doctor, they're using Western medicine to treat diseases, right? So if you don't have a disease yet, they can't really treat you. They can't really do anything for you. But when you get a disease, it's just about managing the condition. So they use Western biomarkers to understand if you have that disease or not. But when you use a functional medicine doctor, we're using Western biomarkers to understand what's the cause of the disease. It's a different way of looking at the blood work. So, for example, a lot of my patients say, I have GI issues and I went to the doctor and I got an endoscopy. And the endoscopy came up with nothing. So I try to explain to them, well, an endoscopy is looking for certain things. If there's a little bit of gastritis, if there's polyps, right? That's mostly what they're looking for. They're looking for things that a camera can see. But it can't see things on a microscopic level, which is where everything happens. It's not checking your gut bacteria. It's not checking if you have leaky gut syndrome, increased intestinal permeability. It's not checking if you have parasites, right? So we use a test that checks for those things, and we relieve those things. So I have patients with ulcerative colitis, all types of GI issues. We do one of those tests, we get the results, we implement the intervention, and they have no more GI issues.
This is with advanced labs.
This is with advanced labs that you have to pay out of pocket for, because it's not within the conventional model, unfortunately.
Right.
But you know what? People are tired of the model. They're willing to pay the money, because if you treat the root cause condition, you pay a little bit of money up front, you spend a little time adjusting your diet, you spend a little extra money on the supplements. You do that once, you don't have to worry about GI issues anymore. It saves you money in the long run.
Amen.
And so, in the field, the industry of functional medicine is growing exponentially. 15 years ago, if you said, what is functional medicine? You talked about leaky gut syndrome, people would say, that's not a real thing. And doctors would say, what is functional medicine? After enough years of research, you've got Dr. Mark Hyman, you've got Zach Bush, you've got all of these doctors that are jumping on board, and they're, 15 years ago, there were minimal medical doctors. It was mostly acupuncturists and chiropractors and naturopathic doctors. Now, it's like the industry is filled with medical doctors and DOs.
Yeah.
Because there's enough results and research to back up what's being said. And the doctors are stressed out also. They know that the medicines that they're giving people isn't going to fix anything. And the people want to be fixed. And it creates a stress in them, because within them, they know they're not helping anything. And some doctors are ethically and morally guided, and they say, you know what, I'm fed up with this, and I'm going to pursue something that is going to help my patients actually heal. Because that's what I signed up for. I want to see people healthy. I don't want to see people suffering. And some part of me knows that the way that I'm approaching this is unethical.
Right.
And then they start speaking it back against the industry. So, functional medicine is looking at your Western biomarkers to find out why you have an autoimmune condition, why you have endometriosis, why you have ulcerative colitis, right? Why you have Alzheimer's. I treat Alzheimer's conditions, I treat Parkinson's, I treat lupus, Sjogren's, all Charcot-Marie-Tooth, X2, all types of exotic conditions, eczema, psoriasis, and it's usually a breakdown of the immune system, of the endocrine system, of the GI system, of the detox systems of the body that have been broken down for so long that the body is no longer capable of taking care of itself. So I go in and I fix whatever needs to be fixed so that the body can take care of itself. So you don't need to be relying on medications.
And when you break it down like that, it's not so woo-woo. It's not woo-woo at all. I mean, and I think I want to say 6 out of 10 people listening to this podcast probably have heard of Dr. Mark Hyman by now, or maybe you can't commit initially monetarily to a full functional medicine program because at the current moment it might not be covered by insurance, and maybe it's a few dollars out of pocket.
Yeah.
But now, if you at least want to maybe get a little bit better understanding, I did Function Health last year, which is Mark Hyman's program, where you do get the advanced labs. You don't get the one-on-one personal. I mean, you get a report, but you don't get to actually talk to a doctor personally one-on-one. But it did give me like a little bit better peace of mind, and did give me some things like, all right, maybe you should cut this out. Maybe you need to boost this up.
Yeah. So Function Health is an approach. It's a strategy that they're using to try to reach the masses. It's more personalized, but it's not individualized.
Correct.
And that's really where the value of functional medicine comes in, because I have patients that are in New York that work with Gundry Health, work with Dr. Mark Hyman, the Cleveland Clinic, Gary Brecka, 10X Health, which is like $50,000, $15,000, and they don't individualize it.
Right.
So I have these patients that they'll go through that process, and then they'll come to me, and then I'll personalize it. And when we personalize it, it's much more effective. So I create like a threshold for my patients where it's like, okay, if you can go all the way in, do functional medicine and Chinese medicine. With the Chinese medicine, I can modify your immune system and your endocrine system and your nervous system with acupuncture weekly or monthly or whatever it is, while staying on top of your progress with functional medicine. So we're intervening with functional medicine, and we're moderating the process with Chinese medicine. But if you can't afford that, then I say come in for acupuncture. Come in for your acupuncture sections. You're going to save more money, and I can, with each section, I can modify within my clinical capacity ideas for your functional medicine stuff. So right now, I have a woman who has a full-blown autoimmune condition. She can't afford therapy, so I've lowered my prices. She comes in for acupuncture, but I'm also giving her tips this week how to adjust her diet. Last week, supplements that she could get on. Next week, we're probably going to go into some injections, glutathione, NAD possibly.
Okay.
And while she's getting her acupuncture. With functional medicine, I can look at all the blood work, I can do all of the testing, and I can create a tailored, personalized intervention, which is a lot of labor. With this way, with the acupuncture way, I can't personalize it as much, I can generalize it.
Sure.
So I create like a scale that's affordable for people.
And when we say advanced labs, you go for your, I go quarterly because I have diabetes, so my endocrinologist prescribes, the labs they prescribes for me, but I go to Quest or LabCorp, I get my blood work, it brings up 12, 15 markers maybe, whereas functional medicine, when you go for these advanced labs, it's 60, 100.
So even then, that's a starting point.
Yeah.
So where I usually start with people is I go for the advanced labs. So instead of just running HbA1c and glucose and insulin, I'm running C-peptide of insulin and glycomark on top of that, because glycomark is going to let me know if something's wrong with your diet that's affecting spikes in your blood sugar, and C-peptide is a more stable marker of insulin. So I'm doing things like that. I'm checking ANA, I'm checking inflammatory biomarkers, and with the GI map, I'm seeing what's going on in your gut that could be driving up inflammation. Inflammation is the cause of all diseases, bottom line. That's it. And in America, we live a very inflamed lifestyle. The food system is kind of destroyed. If you're eating meat, the cows, the cattle, whatever you're eating are grazing on the grass that's been polluted with pesticides. They're eating that, they're absorbing it into their muscles, and we're eating that. If we're eating food that's grown from the ground, The soil is depleted. It doesn't have nutrients in it like it did 20, 30, 40, 50 years ago. The water system, we're exposed to plastics. There's toxins in the air, and these are all real things.
Right.
Like
this is not woo-woo.
This is not woo-woo. This is like when you get into the science and look at the molecular mimicry of toxins and how the molecular mimicry that affects the way your body binds to minerals and vitamins, and why testosterone levels are so low in men. And we're exposed to all of this stuff all of the time. So if your body is exposed to all this stuff, you're going to be inflamed all the time. And that's why we're the sickest country, sickest people in human history, right? We're exposed to all of this stuff. So inflammation is the cause of all of this stuff. So we do those tests, I see what's going on in the gut, and I start there. But the really advanced testing is when you can't find anything in there. The really advanced testing is when you start getting into like checking for toxins, heavy metals, mold, right? Atrazine, stuff like that. When you're checking to see which way the immune system is working, cytokine panels, to see which patterns are showing up that way, checking to see what types of antibodies are not being tested through ANA and getting like specificity on that, right? It's going even deeper into it. And Function Health and most functional medicine doctors start at the same place with these biomarkers in the stool test. But when that doesn't help, you got to go deeper. Yeah. And that's what happened with my patient in New York with Gundry, is like the testing wasn't good. I had to send them to do a bunch of testing, and we found all the immune markers that he's got lipopolysaccharides that are going into the circulatory system, driving up inflammation. He's got a Th17 dominance, which means that he is driving up an autoimmune condition. He's got increased intestinal permeability, and he's probably got lupus and Sjogren's. Right, so it took like way more advanced testing to figure that out.
And then with that knowledge, now you can custom tailor an actual approach that's not a pill, or that's not the traditional medicine system that just treats the tail end of the snake.
Exactly. If you take the pill is treating the symptoms. Right?
Not the root cause.
It's not treating the root cause. And even in the process of treating the symptoms, it can be further damaging the body. I just heard a podcast by Joe Rogan and this immunologist about cancer. And the immunologist was saying exactly like, you weigh as medical doctors, what they do with medications is they weigh their ratios of like positive effects and negative effects when they give medications. It's like, I know it's going to cause this, but if it's going to cause this, I'm willing to accept that because it's helping on a greater good on this level. Mm-hmm. But if it's going to cause more negative effects than positive effects, then I'm not going to do it. That's where the like moral insights and the ethical boundaries internally come in with like medical doctors mostly. You can only hope. But like with medications, there is like this ratio of like benefit to risk, and every medication is going to do that.
And then, so you, from a practical, me not being a doctor perspective, you weigh the cost of not doing anything versus the cost of spending a few dollars, and yes, it can be thousands of dollars, and it can be out of pocket. But then maybe you consider, where are you at in life, age-wise, energy-wise, career-wise? Do you want to be able to live your best life? Do you want to be able... And you've helped, and I've seen people beat and transform some of these terrible conditions. I understand my autoimmune condition at the current iteration, type 1 diabetes, can't be reversed. Type 2, yes, and in the future. But, if there was an opportunity for me to reverse diabetes, I would take all the steps and spend whatever money that there was to spend to do it.
And you can't, you're right, you can't currently, there's like stem cell therapy that's coming out that's showing promise, but there are still ways that you can support your body. You can support your insulin sensitivity, you can support inflammation in your body, which is going to help you at least feel good by treating root cause and making your body the best it could possibly be given your condition. So there are ways, and even like when you work with a Chinese medicine doctor and many functional medicine doctors, I can't speak for all. We're in private practice, so we have ways of like, I don't know if I should be saying this, but like probably compromising ourselves to try to help to the best of our ability without compromising ourselves too much. So my fees are normally what they are, but I have a patient who was shot with a gun through the head. Bullet came out of the other side. He was in a coma for months. He was declared brain dead, and he came out of it. But he had to relearn everything. So I do for him and his family. I worked out a special deal with them to make sure that he can get continued care, because the acupuncture is just showing profound effects for him. He's doing jiu-jitsu now. He can ride a bike now. He's writing. He remembers things. He's doing push-ups. He's getting his life back. And the acupuncture, his vision's coming back, brain activity. And so acupuncture is a huge part of his like progression.
Wow.
And I know that. But if I was rigid and I said, nope, sorry, can't help you because your insurance isn't going to pay for it, and then this guy would not have this progression. But being in private practice, we take this on because we know the struggles that people are having, because most of us have experienced it ourselves.
Amazing.
So, yeah.
And the last shout out to Seth and the Mindful Doctor, as I was fortunate enough to have the experience to live with him for a little bit, and being able to turn to ask the Mindful Doctor a question. He, and thankfully through his podcast and his practice and the men's group and men's work that we do, he shares so much, but he helped me with my type 1 diabetes, so many lifestyle changes, cut out all processed foods. I meal prep, pretty much everything now. Really prioritized exercise and being active, and even little things like being more mindful of the water and the quality of the water and where the water comes from. And you can go, those rabbit holes go deep with reverse osmosis and, and different things, but, it really, even things people are not considerate. And yes, you could be holistic and organic to the nth degree, but it's just something to be mindful of like endocrine disruptors. The traditional deodorant that most men would apply is unfortunately filled with bad stuff.
The thing is so endocrine disruptors are things that disrupt your natural hormone function. So for men, we're talking about decreasing your testosterone levels. For women, we can see like production of inflammatory estrogens and infertility. And same thing for men. So I was speaking earlier about the toxins testing. The toxin test that I do checks for all of that stuff. And when I said molecular mimicry, what molecular mimicry means is your body will see a particle and think it's something else. So it might see something and say, oh, that's zinc. I'm going to attach onto it and bring it into the cell, and that's going to help with my immune system and testosterone and all of these different things. But when you have endocrine disruptors, the disruptor, the particle, will mimic the zinc, and your body will attach onto the zinc, the endocrine disruptor, and bring it into the cell instead of zinc. So your body is no longer absorbing zinc. And that is where your problems begin. And when your body is just flooded with this stuff all the time, your immune system is like, where do I go? Let me attach onto whatever I can attach onto. That looks like the right thing. Let me go for it and bring it in, right? When you're getting more toxins than zinc, when you're getting more toxins than magnesium, right? So endocrine disruptors, toxins, what they do is they mimic the molecules of micronutrients. All of our micronutrients, the minerals, right? Huge problem.
And it's kind of like a silent, process. Like you're not really, you might drink, if you drink water from the tap, in 2025, you really need to listen to this podcast. Really need to, but even like the deodorant. So like fortunately, one of the brothers in our men's group turned us on to more, I guess, like organic, holistic, endocrine disruptor-free deodorant spray.
Yeah.
Like little things, or even like I started getting. I mean, we live in South Florida. Mold is omnipresent everywhere.
Yep.
I started investing in more air filters and air purifiers and different things in the home to try to mitigate that. And other like little like, you know, you really probably you shouldn't be drinking out of plastic water bottles. Like, you know, even if it says BPA free.
Yeah.
You know, and so when you take all of these little steps that add up, ideally, hopefully you can avoid having to do the advanced, you know, labs, toxins, and so on and so forth. But these are the things that come up, and then but I guess the takeaway here is more if you could be proactive and live a more balanced, organic, grounded lifestyle and take this modern approach, you will see, and hopefully you will see changes, you will see benefits, and hopefully you will not have to see the specialist that you might have to go see at the doctor's office for these terrible conditions.
You take accountability for where you can, right? If I can avoid drinking out of a plastic water bottle and I can drink out of a glass bottle, that's a simple choice. It's not going to cause me too much effort to do that. And even when it comes to underwear, if I can buy underwear that's made out of cotton instead of like polyester, because polyester is like considered a microplastic, and that can your testicles can absorb it through there, and your testicles don't have a natural antioxidant to get rid of that. So you have microplastics in the testicles affecting your testosterone levels.
Correct.
Right? But I will say one thing is like when we go to the advanced testing stuff, in some cases people still have to do it. So yes, South Florida is it's called the like epicenter of chronic inflammatory response syndrome in the country.
Wow. Because
of all the humidity in the air that's going to cause mold damage in buildings. So there's a percentage of people, estimated around 30% of people, that have a variation or don't have the HLA-DR gene. I always confuse HLA-DR and HLA-DQ. It's a gene that is responsible for clearing mold out of our body. So if you don't have that gene, or if you have a poor genetic SNP of it, your body's going to have a hard time clearing that mold out of your body. There are people who don't have the genes for that, and they can't even come to Florida because they can smell it in the air, and it can cause a cascade of events in their body. You know, so like that's where like, you know, there's still some cases for some people where it's like you still have to be cautious and know your condition, so that you can make the right types of adjustments and take accountability for your actions.
And if you do take accountability for your actions, and if you do make a couple smart decisions and investments in your future, it literally can change not only the quality of your life, but the outlook of your life.
Yes.
Because I mean, you know, you want to live to be 80, 90 years old, and you know, you look at some people that didn't take care of themselves, and you know the situations that they're in, and maybe they didn't have the awareness or the knowledge or the podcasts or the things, but now we do have these. So I mean, I think this is phenomenal insights, and I appreciate you sharing. And we were talking before, like hopefully one person's life will change for the benefit as a result of this, and I'm fairly confident that will impact one. And please, if you found this any bit interesting or relevant or whatever, don't hesitate to share. You know, you share a bunch of good stuff on your Instagram and social media as well. So I really appreciate you taking the time to break it down. And I guess now that we've kind of just rounded all that out, the last question I'll ask you is, if somebody is curious about acupuncture or integrative medicine, and if they, after listening to this podcast, they're still skeptical, maybe they didn't listen to this podcast yet, what's the first step you'd recommend somebody take?
To learn about it or to get therapy?
To learn, but to determine if they want to get therapy. Oh, I've heard of I get this all the time. I've heard of acupuncture. You know, I've never tried it. Where would I try it? How would I try it?
Sure.
Is it really going to work?
Yeah, you know, I think that's like to me kind of like where I'm at in my life and how many thousands of people I've treated, how many conditions I've fixed, how many Google reviews I have, how many, like people like you who, at this point I look at it so differently where I'm like, okay, do the medications fix you, right? But you don't question those, right?
Right.
Like I've got a patient who he's 80 years old and he's diagnosed with Alzheimer's, and before he came in he got on a medication, experimental research drug, and his wife was the one who brought him in and was like, I just see it getting worse, he's leaving cabinets open, he's forgetting things all the time, I'm afraid he's going to get on the road and not know where he's at. So I did a functional medicine intervention on him, and he gets on the supplements, and it's night and day difference. And, they're like so happy, right? And then he went on vacation, and he couldn't take the supplements with him, and he started to regress. And they came back, and they told me, the wife was worried and all this stuff, so we got him back on the supplements, and he's back to normal, So he he goes back to the doctor. The doctor wants to get him on a new drug, and he's like, okay, yes, I'll do it. And he shows the doctor the supplements that I have him on, and the doctor asks him, like, why are you on all of these? So he comes to me and he says to me, he's like almost taking the frustration of the doctor and like putting it on me, whereas like, why am I taking all of these? The doctor wants to know why this, and that, and the other. And I'm like, okay, well, first of all, I explain it to him, and then I say, because I've got good rapport with him, I can openly speak with him. I was like, you've noticed, and we've documented, that these supplements help you. Night and day, you get off, your symptoms regress. You get on, your symptoms get better. Have you noticed that with the medications? No? How come you don't question your doctor why you're on those medications? Right? The doctor questions me, I get results. Why don't you question your doctor about what's happening? So, when we talk about, like, does it work or not, it's such a weird question because of the way that we're conditioned to see things here, So, but if you need confidence before you pursue something, right, there's thousands of clinical research trials on the internet. There are meta-analysis, like, for a long time, acupuncture was like, oh, that doesn't work, that's not fake, and then all the research came out, and all of a sudden the PTs want to do it, they get it on their schedule, the chiropractors are doing it, the medical doctors are doing it, everyone's doing it now, right, because it works, because the research is there, right? So if you need confidence in knowing if it works, you can see they're jumping on the bus now. We've laid the road, and now they're following the path, right? You can look up the research studies. You can look up the Google reviews. And when you talk to people and they say acupuncture doesn't work, it's likely because they worked with someone who isn't, not every acupuncturist is equal to other acupuncturists, and not every medical doctor is equal to other medical doctors. Not every surgeon is equal to every other surgeon, right?
Mm-hmm.
So, like, they're likely going to an acupuncturist that's not very skilled in that specific thing they're getting treated for. That's the first thing. The second thing is when you're treating conditions that had been there for 30 years, 20 years, 10 years, 9 months, you can't expect it to get better in 3 treatments. Even though I do. I get it done sometimes in 3 treatments. Right? That just comes from, like, the time, my experience, and, like, all the different fields I've explored. But you have to have a degree of expectation of, I'm going to be investing a certain amount of time and resources into this. And if you're not seeing any results in 6 to 10 sessions, switch acupuncturists. That's where I'm at. If I don't see treatment results in 10 sessions, I don't think I can help someone, because I can usually get results and maybe they're 30% better by the 4th or 5th treatment, and maybe they're 75% better by the 8th treatment, and maybe they're 100% better by the 20th treatment, right? Because like I said earlier about the back and the shoulder, right? Like, you feel the pain here, but I could get rid of this pain, and then all of a sudden your rhomboid hurts.
Mm-hmm.
And then all of a sudden, after fixing the rhomboid, your quadratus lumborum. And then we trace it all the way down to the foot where you had an injury in your ankle when you were 19 years old rollerblading, right? And we fixed that ankle issue, and now that's not triggering the calves, which is triggering the knee, which is triggering the IT band, which is triggering your hips, which is offsetting your hips, which is tightening up your quadratus lumborum, which is rotating your spine, which is putting pressure on your rhomboids, which is now showing up is this right here. And it takes time to figure that out. I can get rid of this, but it'll probably come back unless you go down and you treat everything.
Amen. And right, the Dr. Google, or even just the Google reviews, they're there, the proof's in the pudding. Hopefully you gain some insight, and I learned a lot, and some level of trust and confidence. So if you like what you heard here with the preview on the podcast, I encourage you to join us Friday, September the 12th, at the Dakota at our Zero Empty Spaces location. Doors open at 8:30. The talk starts at 9. You're out of there by 10. Completely free event. And we'll have the replay online for those that aren't able to attend. If you need something to tell your boss, I got a whole list of things. You're gaining insight. You're tapping into the community. You're bringing new knowledge back to your team and your company, and you could be back in the office by 10:30.
Yeah, there you go. And Evan, I just want to take you for thank you for taking the time to let me speak on this platform. I don't often get to share the knowledge with people in a more expansive way, and thank you for this work. And maybe at some point I can interview you for the same podcast to find out how you got into this.
I welcome it. I appreciate that. You've always been a wealth of knowledge to me. You've shared great insight. You've always been very generous with the questions that I've asked and the ailments or conditions or injuries, whatever that I've come with. From Seth, I've learned the importance of bedside manner with doctors. You've got great bedside manner, which is not always the case, obviously, unfortunately. But it really has been a joy to get to know you, and I'm glad that it worked out, that we got you coming to share your story, which I'm excited to hear. And there's so much more. I mean, you can see a little bit in the background, you really are living this life, and we haven't even gotten into the herbs and the supplements.
Yeah, I wish they could see the medicine cabinet. This medicine cabinet is over 100 years old. It was given to my mentor's mentor, and my mentor put it in here. This is a very special piece of furniture in traditional Chinese medicine. Yeah, this has its own special value that you cannot quantify.
It's the real deal.
Yeah.
Well, if they want to find out about it for themselves, join us here downtown Hollywood. Log on the website. We'll link it all in the comments and the show notes. And appreciate you guys tuning in. Cheers.